Hello, and thank you for attending our presentation on acupuncture. The people presenting with us today are Ashley, Grace, Danielle, and myself, Sarah.
The overview of acupuncture. Acupuncture is one of the world's oldest healing arts. It is an ancient Chinese medicine-based approach to treating a variety of conditions by triggering specific points on the skin with needles. The practice is based on how energy or qi flows through the body along a series of channels called meridians, similar to the way nerves and vessels carry messages and blood throughout every system. According to Chinese medicine theory, each meridian is related to a specific organ, and placing thin needles at certain points along these meridians can affect certain changes in the body to restore homeostasis. While some people are still skeptics, acupuncture is steadily gaining popularity. According to a 2021 World Health Organization report, acupuncture is the most widely used traditional medicine practice globally. Today, acupuncture is used all over the world. However, some cultures might be more likely to use acupuncture because it aligns with their values, ideas, and traditions. Next slide.
Overview of the Chinese culture. Politically, they had dynasties from beginning in 2100 BC. Since that time, they have expanded, fractured, and reunified over the last 4,000 years. The last dynasty ended in 1912 when the country emerged as Republic of China, which was led by the National Party. And in 1949, the National Party was taken over by the Communist Party of China, making it a communist country, and it still is to this day. However, there's some amount of political autonomy within the 33 nations because of a judicial system, such as the Supreme People's Court of China holding the highest power than the local people courts. Going on to economy, the biggest export are agricultural goods such as cotton, tea, rice, soybean, and potatoes. Manufactured goods are also a significant part of the export, such as electronics, medical equipment, plastics, iron, and steel. Going on to religion and society, the Chinese government recognizes 5 faiths, which would be Buddhism, Taoism, Catholicism, Protestantism, and Islam. If you have any religion outside of these 5, it is not tolerated well by the government. There are more than 50 ethnicities in China, such as the Zhuang, Hui, Mongol, Korean, Mongol, Tibetan, and Russian. However, there are very diverse communities within China that are also subgroups of those ethnic groups. The official language is Standard Chinese, but as I said earlier, there's various ethnic groups, so their language varies within those. Geography. In the north, there's the Gobi Desert, as well as the Taklamakan Desert. In the west, there's the Himalayan mountain range, as well as others listed. On the eastern side of the plateau, there are 2 rivers called the Yangtze and Yellow Rivers. Coming up on the China healthcare system, as of 2020, China had poor quality of care when it came to primary health care. Among a study, there were incognito patients with chest pain and common illnesses. Chinese doctors addressed 36% of the essential questions and examinations necessary to make a proper diagnosis. Furthermore, they only correctly diagnosed 26% of these illnesses of these patients that were being seen. In addition, there is also a overuse of antibiotics within the country. Greater than 50% of primary care institutions are prescribing broad spectrum antibiotics to their patients, which is leading to the spread of drug resistant strains of bacterias. Going on to the undereducated physicians, in 2010, it was 41% of physicians in community health care centers and 60% in township healthcare centers only had a junior medical college level education. So for comparison, that is the requirement for a licensed physician assistant in the United States. But also there was a 20% of practicing physicians that were not licensed in China, which posed a problem because this led to the poor quality of care with the antibiotics and not being seen and treated and diagnosed correctly. Another problem that contributes to the gap of poor public health care is that they don't make it obligatory for patients to see their primary care provider before going to the hospital, which is making the hospital admission rates higher and leading to this overcrowded and overpopulated hospital population and leading to this large ratio of patient to provider, making this provider shortage even worse. Moving on to healthcare, in hospitals, the hospitals have a multi three-tier system. Primary, secondary, and tertiary, which just means they all have different levels of which they treat patients. Primary being the best, secondary being second, and tertiary being the third. Primary hospitals are usually affiliated with universities and are in big cities, urban settings. Secondary are usually medium-sized hospital and located in districts and counties, and then tertiaries are just kind of private hospitals. When going to health insurance, they have basic medical insurance, but that has subgroups for resident and employee. So for employee, the employer will provide you with this basic medical insurance. And then if you don't have a job, you get resident basic medical insurance. And that just covers most of the charges when you go to the hospital. Like I said, it's basic. If you cannot meet the requirements for resident or employee basic medical insurance, you are eligible for medical aid when you are deemed low income. And again, it covers the same things as basic medical insurance, but they have to go through different hoops to get it. And then if your costs are not covered by these two policies, the use of commercial health insurance, charitable donations, and medical mutual aid activities are accepted, which is not as popular because basic medical insurance and the medical aid are given to mostly everyone in China.
Acupuncture in the Eastern Asian culture, past compared to the present. In the past, the modern word acupuncture was misleading as there is no evidence from the Shang and Western dynasties to support the idea that needles were used in any way to the energetic system of medicine. And then it goes on to talk about how the Han Dynasty implied the term acupuncture, crafted stone needles that have been unearthed by Shang and Zhu tomes. Forgive me if I said that incorrectly. And then is a quote from the end of the Han Dynasty greatly increased the numbers of acupuncture points were described, and ever more detailed explanatory and diagnostic models came into being amongst the medical literacy. The Mayo Clinic had a great quote about the traditional Chinese acupuncture that was believed to balance the flow of energy or life force. Additionally, the Mayo Clinic in the present stated a wide variety of ways that we use acupuncture for, such as neck and lower back pain, laboring pain, osteoarthritis, chemotherapy-induced pain, respiratory disorders, and then stress relievers. Next goes on to say the three main steps of acupuncture, but that will be explained on a later slide. And then finally, I wanted to include a graph that shows how patients with PTSD would use acupuncture to relieve their stress symptoms. And I know it's small, but in the first section, you can see how the second two columns are so much lower than the final section, which would be compared to having no treatment. Next slide, please.
During the past 40 years, acupuncture is a therapeutic technique of Oriental medicine and its origin, and has become more popular, evolving into one of the most utilized forms of complementary integrative medicines interventions in the United States. And in fact, more than 10 million acupuncture treatments are administered annually in the United States alone. Its rise in popularity, particularly in the West, can be attributed to, in part, its effectiveness for pain relief. And that is a quote from Howe Metalum. And the Western acupuncture practitioners believe that acupuncture stimulates nerve, muscles, and connective tissue. Each person who performs acupuncture has a unique style, often blending aspects of Eastern and Western approaches to medicine to determine the type of acupuncture treatment that will help you the most. Your practitioner may also ask you about symptoms or behaviors and lifestyle. They may also examine parts of your body that are painful, the shape and the coating of your color of your tongue, and the color of your face. Next slide, please. The actual process of acupuncture are points situated all over areas of your body. Sometimes the appropriate points are far removed from the area of your pain. Your acupuncture practitioner will tell you the general site and the planned treatment, and will discuss with you whether you need to remove any clothing, a gown, towel, or sheet will be provided. The needle is always a clean, sterile, single-use needle, and the needles will be inserted at various steps at strategic points on your bodies. The needles are thin, almost hair-like, so the insertion usually causes little discomfort. People often don't feel them inserted at all. You may feel a mild aching sensation when the needle reaches the correct depth. Needle manipulation may sometimes be necessary. Your practitioner may gently move or twirl the needles. After placement, apply heat or mild electrical pulses. The needle will then be removed after a time period that the physician has deemed necessary. And in most cases, the needles remain in place for about 10 to 15 minutes. While you lie still and relax, there is usually no discomfort when the needles are removed. And after the procedure, some people feel relaxed and others feel energized after an acupuncture treatment, but not everyone responds to acupuncture. If your symptoms don't begin to improve within a few weeks, acupuncture may not be right for you. So it's best to discuss this plan and appropriateness with your physician. Next slide. The most recent research findings have shown that acupuncture may be helpful for several pain conditions, including back, neck pain, knee pain associated with osteoarthritis, postoperative pain, and relieve joint pain. An analysis of data from 20 studies of 6,376 participants with people with painful conditions showed that the beneficial effects of acupuncture continued for a year after the end of treatment for all conditions except neck pain. Complications due to acupuncture could be up to rare complications such as disease transmission, needle breakage with a fragment left in the body, nerve damage, pneumothorax, pneumoperitoneum, organ puncture, cardiac tamponade, osteomyelitis, and most commonly the local complications of bleeding, bruising at the insertion site, contact dermatitis, infection, pain or soreness at the insertion site, and paresthesia. Next slide.
I have one thing to add with the benefits.
Go ahead.
It's proven to help in the case of hypertension. It has been shown to reduce systolic blood pressure by a 6 to 8 millimeters of mercury and diastolic blood pressure by 4 millimeters of mercury within 8 weeks of patients who are not on antihypertensives. If the patient's using antihypertensive medication, acupuncture has shown to lower systolic blood pressure by 34 millimeters of mercury and diastolic blood pressure by 15 millimeters of mercury. So it does help with hypertension when some providers think that it will not because it's contraindicated due to it can drop your blood pressure pretty quick.
Thank you. As a provider who wants to advocate for their patients regarding cultural beliefs, You should ask questions about your patient's cultural preferences. You should always ask. There's no harm in ever asking your patient anything. Then you should plan to implement those cultural practices as a part of the care plan. Don't just ask, you should actually implement them. That helps build the helpful relationship and also ensure trust with your patient that you are going to have veracity. Coordinate care plan with members of the healthcare team and notify members of these cultural considerations. You should let everybody know that we'll be working on your patient of these cultural considerations so that way is continually honored their beliefs. Collaborate with interdisciplinary team members to ensure appropriateness of each cultural treatment, such as medications and the pharmacy. Some treatments may not be appropriate for certain diseases, but also validate your patients regarding the cultural beliefs. Assume that their beliefs are valid just as your own, and you should verbalize that to them. Implications for healthcare providers that are utilizing acupuncture as methods of pain relief or anti-inflammatory would be local complications that we discussed earlier in the slide, and also the rare complications.
Originating in China, a country rich in culture and beliefs, acupuncture is one of the most widely used treatments today for pain relief. While there are both pros and cons for both patients and providers, the treatments have been around since the beginning of time and surely isn't going anywhere. Society can look forward to improved techniques as well as the treatment becoming a more accepted option for their symptoms.
Just our references.